And welcome to the Alternative Crisis Response Public Hearing. I'm Councilmember Emmanuel Remy, Chair of the Public Safety Committee, and I am joined today by my co-host, Council President Shannon Hardin. I want to remind everyone that this hearing is currently live on YouTube and Facebook, and is also live and being recorded for rebroadcast on CTV, Columbus's government television channel 3. The rebroadcast schedule is available at www.columbus.gov. I also want to recognize and thank my other council colleagues joining us here today. Lourdes Barroso de Padilla is in chambers. Thank you for showing up. And Councilmember Dorans, I believe, is online. And of course, there's bound to be others as we navigate this hybrid pandemic meeting schedule. I also want to thank and welcome to our presenters today, Robert Clark, the Director of Public Safety, Dan Giangardella, Deputy Director of Public Safety, Ken Kuntz, the Administrator Support Services, Anita Clark, the Assistant Health Commissioner, Columbus Public Health, Commander Dennis Jeffrey of the Columbus Police, Lieutenant Isaac Tolliver, Columbus Fire, and Captain Matt Parrish of Columbus Fire. The purpose of this hearing is to learn more about the various alternative crisis response units and services available through the Department of Public Safety. Our presenters will provide an overview of the progress of these programs, in addition to goals and future planning. The alternative crisis response includes the following services: the Right Response Unit, Mobile Crisis Response, Rapid Response Emergency Addiction Crisis Team, Specialized Program Assessing Resource Connectivity, the SPARK program. Prior to my becoming Chair of Public Safety Committee, Council President Hardin and his team spent an extensive amount of time contributing the city's alternative response work. So I want to turn the floor over to him to share a few words. Thank you, Council President Hardin. The floor is yours.
Well, thank you, Mr. Chair. I also want to say thank you to the administration for the work that they've done over the last year or so as we pull together the right response model. Certainly want to thank all those folks who helped pull together this hearing, and my colleagues, Councilmember Barroso and Councilmember Dorans, for being here. More than a year ago, Council started talking about how to reimagine safety in Columbus. That effort started with specific reforms. As we can remember, Council instituted critical changes like limiting no-knock warrants, prohibiting any potential hate group affiliation, establishing a civilian review board, and we did much more. Council asked the community how they wanted to see the city invest in safety. We received feedback from thousands of residents and held countless town halls. The part of the reimagining safety that I've most been passionate about is alternative crisis response. To be clear, alternative crisis response is trying to answer what seems like a simple question. Sorry,
We're having some technical difficulties we'll work on here.
All right, can you guys hear me now?
Yeah.
All right, I was gonna make the joke that you should have heard it was good, but I'm gonna repeat it, and then you'll see that it was just what it is. Important information though. I start off by just thanking Chair Remy, certainly for pulling us together, my colleagues, Councilmember Barroso de Padilla and Councilmember Dorans, the administration for not just being here this evening, but for the work to pull together the right response model, and then certainly all the folks who worked on this hearing. As a reminder, more than a year ago, Council started talking about how to reimagine safety in our city. That effort started with specific reforms. Council instituted critical changes like limiting no-knock warrants, prohibiting any potential hate group affiliations, establishing a civilian review board, and many more pieces of reform. Council asked that the community we asked the community how they wanted to see the city invest in safety, and we received feedback from thousands of residents and held many town halls. But the part of reimagining safety that I've been most passionate about is alternative crisis response. Alternative crisis response is trying to answer what seems like a simple question: How can our city government deploy the right people with the right training at the right time to best serve our residents and keep all of us safe? The administration has heard this call and has been working on a few different efforts to answer this question. I want to thank the staff and directors who are with us virtually, as well as my colleagues for joining us today. With that, I'll turn it back over to Chair Remy to get the hearing started.
Thank you, President Harden. Without further ado, I will turn, do we have Director Clark on? All right, so I'm going to turn the floor over to Deputy Director Dan G.
Thank you, Safety Chair Harden, President Harden, members of council, and my colleagues tonight. We're pleased to be here and to talk about the right response model, sometimes referred to as a term response. I think in some respects it is the same thing. So from the beginning, the crisis response that we're talking about tonight has been a collaborative effort between public safety, in particular divisions of police, fire, and sports services, and Columbus Public Health, to ultimately reduce the reliance on uniform response, but also improve the way the city responds to individuals in need. We began this process by looking at current response units that were created to address specific issues in the community, such as the police mobile crisis response, that were originally intended to stabilize 911 crisis situations involving mental health, and rapid response teams and fire, such as React and Spark, that oftentimes were intended to address substance abuse situations. I think President Harden kind of set the goal correctly there. I think he used the word right 3 times, and that is true. We're trying to connect the right individuals with the right resources and reduce reliance on police and fire and EMS for crisis response, and try to improve and innovate the way in which public safety responds to mental health in partnership with Columbus Public Health and others for these situations. Back in April 1st of 2021, the Public Safety Department, at that time largely led by the Division of Police in the call center at that time, began a program to transfer mental health calls involving juveniles to Nationwide Children's Hospital. So we have a partnership with them. We have had that since April to transfer juvenile mental health calls to them, where they triage those and try to alleviate those issues or set individuals up with a proper source. There are sometimes occasionally where that can't be done, and those calls infrequently, I will say, do come back to us. But that is a partnership that began in April, and although those are not the most numerous calls we get, nonetheless they are important. So in some respects, we began this a little bit earlier, and then of course in mid-May, on May 14th actually, 2021, Mayor Ginther announced the pilot program to triage mental health calls to the 911 Emergency Communications Center. We actually, in collaboration with our partners in health, as well as police and fire, actually launched the program on June 7th of this past year at the 911 center, utilizing a 911 dispatcher in the Division of Sports Services, a social worker for Columbus Public Health, and a paramedic firefighter for the Division of Fire to triage mental health calls, initially Monday through Friday from noon to 4 p.m. This past fall, we also added, Columbus Health added a supervisor to that program and to our triage unit. And then we have made preparations to add a second social worker. Actually have added a second social worker to that program. We, again, working with Columbus Public Health, there are plans to add a third social worker as well as a second shift supervisor, and also a additional, expand those hours, expanded triage hours. And of course, at the same time, we are reviewing potential locations for triage in the group as it expands. I want to call your attention to the slide currently up there where it talks about alternative response units. And while you will hear more about these in a few minutes from Commander Jeffrey in police, as well as either Captain Parrish and fire, as well to talk about more specifics on these. But basically, we have sort of 4 units that are involved in this. Of course, the call center, under the heading of the right response unit, is the first point of contact. We say that they're our primary responder. As I said earlier, a dispatcher, a clinician, now up to maybe hopefully as many as 3 clinicians, and a supervisor and a firefighter. They determine, as Administrator Cruz will talk about a little bit, what happens to those calls. Then we also have another primary responder, of course, the mobile crisis response, which I discussed earlier, and Commander Jeffrey will go in depth on. And then, of course, 2 response units and fire, what we call secondary, meaning they're not showing up initially on the scene. They typically follow up after they've been provided more information. So with that, I will let Administrator Kuntz and from Columbus Public Health, Anita Clark, address more specific about the actual program and how it works, and some of the statistics on calls that we've taken so far. So Ken, if you want to chime in here, thank you.
It's a pleasure to be able to present to all the council members. We are very, very excited in the Division of Support Services for this alternative response program in the RRU. We've seen tremendous success, but to give you a basic overview of how this program works, primarily our residents have the ability to call into 911 or our non-emergency police line. Once that call is received by one of our call takers will assess that call, make a determination if that call meets the parameters for our clinicians in the RRU. If it meets the parameters with the permission of the resident, if they agree, we will do a warm handoff from the call taker to the clinician who actually answers the phone in the RRU unit. At that point, the clinician will attempt to connect one of our residents with either the City of Columbus resources or other community partner resources. Of course, these calls can be unpredictable at times, and some of them can escalate. Primarily, our function in the RRU is to try to, one, connect the resident with the right resources, and if we're unable to connect them or if the call escalates, we do have the ability to allow the clinicians to continue to de-escalate the situation. We have a dispatcher that is in the room. That dispatcher is then able to work with the clinicians and get the right response on the way to those type of calls while the clinician can remain on the line de-escalating the situation. At that point, we would then dispatch either police or fire or medical to the various situations. Currently, we are operating the RRU from noon until 4 p.m. With some limited resources. The plans are to expand in the very near future to expand up to 8 hours during the day, supported with clinicians and the communication center call takers or dispatchers. One of the policy programs that we are working on right now, we're attempting to draft a policy which will eventually require that all mental health related calls get sent back to the clinicians in the RRU, and then at that point the clinician will then attempt to assess the call on whether it's a call that they should handle, whether they should send it back into the room, if there's community partners, or in the future if 988 is available to deal with that call. The Right Response Unit did launch back, at least the pilot launched back on June 7th. Since June 7th of 2021, we were able to handle about 450 calls in the RRU. Out of those 450 calls, about 1/3 of those calls were able to be completely resolved by the clinicians inside of the RRU, meaning 1/3 did not require any type of police response, which is worthy of noting that 100% of those calls in the past would have resulted in some type of a police response. Thankfully for the RRU, we're able to try to assess those calls, and we were able to successfully defer 1/3 of those. I believe that the RRU, like I said, we're extremely excited by it, and it's had a great influence even on our own communications center. It's very common to actually hear some of the dispatchers talk about the things that they're learning from the clinicians, de-escalation techniques that they're able to use when they are on calls or receiving 911 and frantic calls. As well as they're learning new resources for the community. So it's had a great influence on all of us. I believe there's a lot of success stories. Anita, would you like to chime in?
Sure, Ken, and thank you for that, and thank you, members of council. I have a couple stories I want to share that I think is very impactful when we talk about the RRU. And the first call that I want to talk about involves a library patron that had been residing in the library, and there was a call to the RRU, and after an assessment and consulting with the staff there, it was determined that the NCR staff would be the best responder for this situation. Again, the woman was in the library. She was having a mental health crisis and very, very emotional. And needed immediate help. The MCR team was able to help the woman arrange for her children to be picked up. The client was suffering from hallucinations and was initially agreeable to ride along in the wagon, but changed her mind as she felt paranoid that she was being bugged and wanted to go back to the library. She requested EMS transport. Instead, while waiting for the transport, the MCR staff engaged her in deep breathing. And I just really want to shout out to the medic that was on the MCR team that day, because he helped her with that deep breathing and calmed her down. The MCR staff rode with her to OSU Center, where she was admitted, and stayed with them throughout the intake process. And the situation clearly outlines the importance of the specialized skill set in those moments, starting with the call, then providing options, companioning, being supportive presence, and also sharing ways to de-escalate and utilize mindfulness techniques. Another call that I want to mention is regarding a 74-year-old homeless man from a different county, but he was, of course, in Franklin County at the time. He'd been released from the hospital and being treated for both schizophrenia and bipolar. He kept returning to the gas station, so a call resulted into the dispatch center, and the RRU clinician took the call, then coordinated with the man's guardian to get background information, including details on where he was staying at, which was a local hotel, and facts about his medication refusal and being unable to stay in multiple group homes over the years due to his disruptive behavior. Additionally, the RRU team connected with the caller's existing case manager and referred to the Spark team for additional resources in Columbus for older adults. This story is a great illustration of the problem-solving, fact-finding, care coordination, and connecting with the Spark team that is needed for our residents. It shows the groundwork and complexity that is also needed to get to the right solution for those in crisis. So those are just two really good examples of calls that we've taken in the RRU center. And lastly, I just really want to mention the collaboration, as Ken had mentioned in the RRU. The dispatchers are listening to those clinicians, those social workers. They're picking up wonderful skill sets on how to de-escalate clients. And what's been really amazing is to see the collaboration amongst the dispatchers and the clinicians. They're starting to trust each other and really relying on each other to debrief those very difficult calls that they get. So we've been seeing some wonderful relationship building within that dispatch center. And with that, Ken, do you want me to go ahead and move forward to our next presenter? If there's no other further questions? All right, and that would be Commander Jeffrey. I think you're next on the slideshow here.
And this is a specialized unit within the Division of Police that respond to immediate mental health emergencies, meaning a lot of times they're being dispatched in the moment, or many times officers out on the street might be interacting with someone and feel that MCR might be a good resource to call. The officers that work MCR all receive crisis intervention training. This is a 40-hour class that focuses on de-escalation situations with individuals experiencing a mental health crisis. And what's unique about the training is they're getting this from a variety of instructors to include physicians, social workers, and most importantly, individuals who have mental health illness themselves and their families. So they get a very broad perspective on how to interact best with those experiencing a crisis. The teams pair a CIT officer with clinicians specializing in mental health from Columbus Public Health. Calls for service in which an MCR unit responds have rarely resulted in a use of force or arrest, and that unit averages about 4,000 calls a year, so that's very significant. They're able to interact with these individuals and not have any significant use of force. No officers engaged with MCR units have ever used deadly force. And once the MCR team arrives and they kind of triage that individual, the unit tries to refer that person to secondary resources. And a lot of times those individuals are already connected with providers, and sometimes that's just reconnecting an individual maybe with their case manager so they can kind of get that person back in a good place. Currently, the unit is available from 10 a.m. to midnight, 7 days a week. So now I will pass it over, I think, to Lieutenant Tolliver.
Thank you, Commander Jeffries, President Harden, Safety Chair Remy, members of council. I just want to say I appreciate the opportunity to talk a little bit about the REACT and the SPARK programs. REACT is a rapid response emergency addiction crisis team, and it's housed in the Division of Fire. My name is Isaac Tolliver. I am the day-to-day supervisor for the SPARK and the REACT teams. Currently, we're made up of paramedics with the Division of Fire. We also have Columbus police officers. We have 2 social workers, one with the Central Ohio Area Agency on Aging and the Franklin County Family and Children's First Council. We also have 2 clinicians. One is with Southeast Healthcare. The other is with Primary One Health. And that's basically the makeup of the team. Mainly what we do is for all non-fatal overdoses that are in Franklin County, we'll go out and we'll do follow-ups and we'll do outreach. Basically what that looks like is we'll get a good address on the person that might have had a non-fatal overdose. We'll go to their home, we'll knock on the door, and we'll try to engage them. And really, it's just about building a relationship. Most of the time, people aren't going to want to go to treatment right then. But as we continue to follow up, maybe it's with a text the next day, maybe it's the next time they overdose, they keep seeing the same people. We're just making that connection. So when someone's ready for treatment, we can screen them in, we can get them the treatment the same day. We often try to make sure we get them the treatment that they are actually looking for and that what we think is best for them, since it's up to them how the type of treatment that they want. And we do understand most people with substance use disorder also has some kind of mental health diagnosis as well. So we definitely want to get them to the best treatment. And as far as building that relationship and having all those tools, it really helps us because a lot of times we're knocking on the door, and if we don't get the individual, we might be getting a grandparent who's trying to raise their grandkids. So having all those other agencies with us definitely helps us be able to link them to any other kind of resources that that person might need. We also do have a case manager who follows people, our substance use for people in recovery. And we have an alumni program. So basically monthly, we try to get together and do social events for people in recovery. That's part of our alumni. Whoa, my light switch just went off. And just to help build that, continue that process with them. And we do take some emergency runs. If whoever's doing outreach, since it's a paramedic and a police officer, if they could be first on the scene for something like an overdose, they will respond. Also, we have pulled up on house fires, on apartment fires, pedestrian struck. I mean, there's been a few different ones we've actually pulled up on and we're able to help. Lastly, REACT does a lot of harm reduction. So if we have, we'll go out and we'll do Narcan training, and we also give Narcan to individuals. And we also do hands-only CPR. We do have mannequins that we take with us on certain community events. And that way we can get people's hands on the mannequins and actually do hands-on CPR. And lastly, we do give out fentanyl test strips to individuals that might want them as well. As far as our team, we're usually in service from 8 to 4, Monday through Friday. There are some Saturdays we're also available, but our phone is 24/7. If they call, if we don't answer, they leave a message. We'll get back to them the very next day. And we do try to follow up on all the non-fatal overdoses within 48 hours. It might be 72, just depending on how hard it is to find the individual. Moving on to the next slide, the SPARK team is the Special Program Assessing Resource Connectivity. And basically that is just someone from social worker from Central Ohio Area Agency on Aging and a paramedic. So we'll get referrals from anywhere in Franklin County. Most of them come from EMS, including some of the townships, but we do have community partners that give us referrals as well, whether it's some of the hospitals, social workers, maybe it's APS. And basically our teams will go out. And again, it's about building relationships. We talk to the individual. We try to get them resources that we think they might need or resources they tell us they need. Some of them will take it. Some people are a little mistrusting. Some of them think, maybe we're trying to get them into an old folks home or something like that. But that's not the case. We're just really trying to get people the help they need so they can age in place if that's something that they want to do. Some of the referrals we get might be the medically fragile. We also get high utilizers of EMS, people with unmet needs. Could even be, something like aborting. But having that social worker there definitely helps with the resources that I know a lot of the paramedics don't know about. And then having that medic there to be able to take care of the person on the medical side and just assess to make sure they're medically stable and that they can continue to stay at home at that time is very important. Program has grown from year to year. A lot of that's due to communication. We definitely follow up with the person who gave us a referral, let them know how it's going. And just between the follow-up, seeing the reduction in runs, we just continue to tick up year after year with the programs. So unless anybody has any questions, I will turn it over to Captain Parrish.
Thanks, Lieutenant Oliver, President Harden, Safety Chair Ramey, members of council. I think you've heard a little bit about some of the resources we have available in public safety currently with the different programs and how we're blending them all together and collaborating. One of the things that's on the horizon that there hasn't been a lot of discussion about is 988. And if you're not familiar with that, it was federally mandated to become the 3-digit crisis number for mental health and substance use crisis, and not to replace the current suicide hotline number, but to integrate that in and direct people to the right resource. And it goes right along with our number one aim in this program, which is, to connect an individual in crisis with the right resource in the right amount of time. And I think 911 has become that catch-all for all of these services, and hopefully the integration of 988 and the collaboration between 911 providers or responders and the 988, which will be based with the community resources, will help us to direct or navigate the individuals to those right resources. Currently, it is mandated to begin implementation in July of this year. It's going to be a slow rollout. You look, we're 50 years into 911. It's going to take time to integrate and educate the individuals on that. But by working with our response teams and having a direct connection with them, calls that come into 911, which are more appropriate for a community-based, non-public safety, non-uniform response, can be transferred and directed to the 988 community. We've been fortunate here that we're working with local agencies such as AdamH. We've been working with state agencies such as OMAS in developing this, because it is going to be a statewide, countywide, national program. And to that, we've been invited to participate in several learning communities at the national level. So we can really create this care traffic control system where we start with the lowest, least invasive response and get the individual in crisis connected with the best resource. We've got a lot to learn from it. There's still a lot of unknowns, but I think we're on firm ground here in Columbus with the resources we have together. As you probably understand, coordinating this with multiple agencies at different levels is going to be challenging. But I personally believe that the state and the county is looking to how we're doing it and what we're doing it, and then leaning on some of those best practices that we've learned at the national level from groups such as SAMHSA and NAMI of what a continuum of care can look like. That's really where we're at with the future on this portion. I think we've got bigger plans locally here, and we'll move into that next discussion, and I'll turn it back over to Director G.
So I know we want to talk a little bit about items to be addressed moving forward as part of this. And, of course, one of the challenges I think we're all having right now a little bit is the pandemic, which has sort of hindered our short-term ability to staff some things where we like to and triage calls a little bit more. But we're pretty confident we're going to overcome that. It's just a matter of time, maybe just a little short-term hurdle we have to achieve. With respect to the call center, we do have 7 call takers in training right now. We have an additional 10 that will start class before the end of this month. And we're doing interviews and trying to staff up for another class, as many, hopefully, as 16 by late spring, early summer. So we are addressing those needs as well. In police and fire, of course, I think in police in particular, we have 170, I think it's 170 officers that are going to be hired this year over 3 classes. Fire 125. In addition to that, the mayor's budget includes an additional 5 firefighters specifically for the alternative right response program, as well as 5 additional dispatchers for the call center. So there are opportunities to expand the program, and the mayor has graciously provided some funds to do that. Captain Parrish talked about sometime this summer moving forward, we're going to have to figure out how 988 and some of our partners play into this program. Obviously, that's a collaboration we look forward to, and something that we'll have more to say in the future about that. As this program expands, we'll need additional vehicles, and we will also be looking probably for a place to locate, depending how big this gets, a place for some of our responder units to work out of. And of course, technology always plays a role, whether that's computers and monitors for the call center or technology that needs to go into the vehicles. The mayor, again, has provided in the 2022 budget $2.4 million to address expansion needs. So obviously, we believe there was funding available to take care of those issues. And I think actually, if you looked at the entirety of the budget right now, or what kind of money we have devoted to this program, if you look at the 5 MCR teams, the 3 REACT teams, the 2 SPARK teams, the clinicians and social workers in the health department, you're probably looking at a commitment in this budget right now of probably a little over $4.5 million, not including the additional funds that the mayor has placed in the citywide account. So there are significant resources dedicated to this program, and I think all of us that are involved in this look forward to the potential to expand this in the coming year and hopefully thereafter. Well, if there's anything else I could wanted you to address on the budget end of this.
Yeah, Director, so on the cost associated with the expansion, every time we add an hour, for instance, what are we looking at from a cost perspective when we think about the right response unit in particular?
Well, I don't know if I'd be hazard to do my multiplication and give you an hourly cost. Some of these units we'll work more than Monday through Friday. I mean, ideally, we'll be able to expand as we plan to the right response unit, the triage unit. Most of these, and Captain Parrish or Lieutenant Tolliver could speak to this, but I think most of our units right now are mostly on a day shift operation, probably Monday through Friday. Hopefully this will give us an opportunity to, as we move forward, to maybe expand those out a little bit more. But again, I think we've got to get our staffing up. We've got to get a little bit through some of the short-term issues with this pandemic. But I'm pretty confident that we have funds in place to handle any short-term expansions that we need. In addition to that, we've had Division of Fire has been successful in getting some grant funds. So some of our current models in React and Spark have been able to use some grant funds. So I think from that standpoint, we're in pretty good shape. But we just need to figure out how far can we go with the program at this point.
Understood. This would go to Commander Jeffrey or Captain Parrish, but really, it's nice to do these things during daytime hours. The real needs at night. Would that be a correct statement? Would that be accurate?
Yes, sir. We always look at our data, and a lot of times these mental health calls kind of start in that early afternoon and go till about upwards like midnight, a little after. So we obviously that's MCR works that way. So that's why they're staffed till midnight. But absolutely, I think if we could expand this to cover more hours of the day, it would be very beneficial.
Yeah, I think to Commander's point, it's a complex formula. It's not, we're used to the traditional fire response. We need to have a crew there in 6 minutes or less. And this is such new territory. There is no standard. Some models use a 30 minutes or less response time for certain things. But I think this tiered approach will allow us, once we know what the volume is, how much the community providers are going to provide the response for, and then what is going to depend on public safety's response. Ideally, to have a team that can be dispatched through 911 24/7 to respond would be the ideal situation. But really, our goal is to have the right amount of resources in place for when we're at our highest volume and the community response teams aren't available, so we can fill that gap for them. And then when they are available, have them manage most of those responses. So to Director G's point, it's very tough to put a price tag to it. And some of these calls are complex, and we don't know exactly which clinician or resource is required for that call. So that's one of the beauties of having multiple agencies working together. We've almost created a Swiss Army knife of resources. So if we're dealing with a call that has a nexus to homelessness or an aging adult, can we provide a specialist to respond along with public safety or independently to that caller?
Councilmember Remy, also, if I could just piggyback on that. So we actually have looked at for the calls for 2021, and we had about a little over 22,000 mental health calls, and these were related to just what we refer to as a mental health disturbance, an accidental overdose, a suicide attempt, or a mental health related call in general. We sort of have 4 categories broken down for those. So again, about a little over almost not quite 23,000 calls. And we have looked at the peak times for those, and actually I'm looking at a graphic here. Probably they start picking up around midday, and it continues pretty consistently until about midnight. Now, there are calls at all hours of the day, frankly, but probably just about 11 a.m. to about midnight is sort of the peak window there, and that's of course what we're trying to target. I don't have the week. Actually, I do have some weekend data as well, and the days don't seem to matter much. We average probably about 3,100 calls a day. Again, these sound like big numbers, but just keep in mind, this is a 24/7 operation. If you broke this down into strictly into hours, you're only talking about 3 or 4 calls an hour. That's not to say that those aren't important calls, they are. But on average, this isn't a high volume call necessarily that we get. Keep in mind, we get over 700,000 911 calls a year. So, but again, when you look at the numbers holistically, almost 23,000, it sounds like a very big number. So hopefully that answers your question.
Yeah, I mean, understood that we have to start somewhere, and starting at a point where we're maybe less volume to make sure we're working out the procedures and the processes that are needed for, effective triage. So I understand, but ultimately the goal is at 11 to midnight, really to fulfill the needs of the community. Captain Parrish, is there any one city that you're modeling after, or is it a variety of cities? What for the rapid response unit? Right response, excuse me.
Not necessarily one city in particular. We've again, I talked about some of these learning communities at the national level, and we've been fortunate to build some relationships and have conversations with agencies across the country and learn from them. But I also think they're learning from us because, Commander Jeffrey and I have been in this co-responder space now at least for the last 4 years on building these alternative response teams when we started with React. So there's a couple of different models, but we're really trying to tailor it and make it unique to Columbus and Franklin County. One thing I think from our conversation that really sets us apart is our collaboration with the local mental health and addiction board here with Adam H. and their willingness to partner on the community response side. To Director's point, overall, we do a really good job of responding to these calls. And whether or not it's one of our community response team or co-responder teams or just our patrol and EMS, the challenge becomes not after you stabilize the situation, it's where do you go next? So even if you have response teams available at 1 o'clock in the morning, where do you go next with, what's the next step for that individual in crisis? And that's really the big challenge that's going to dictate, how we build out our system and how robust that needs to be, because as more resources are available downstream and more connections that happen quickly, that frees up that team to take more calls. And that's what we experienced with the RRU. The sooner they could kind of end that call or close that call or refer that caller to the right resource, they were available for another caller. And that's the kind of the magic formula. But we've talked with San Francisco, we've talked with Austin, Denver, the folks at Cahoots, we've talked with the Portland Street Response. That's one of the beauties in the fire service is we collaborate on everything. So it was easy to reach out and make connections in those other cities and find out what's working well for them.
Thank you very much, Captain Parrish. I do want to recognize my colleague, Councilmember Favor, is also on WebEx. And so I'm going to go ahead and go around the room, see who has questions, if you want to make a comment, that sort of thing. I'll start with Council President Harden.
Thank you. Can you hear me? All right. Thank you again for the presentation. Let me not bury the lead. I think it's really important to say that where we are and what we've accomplished in a short amount of time is to be applauded. We've had over the last couple of years some very tough conversations about how we interact with our residents, how we keep our residents safe, and how, regardless of one's zip code, the color of their skin, and really we should add, their mental state, that we approach each of these instances with the appropriate engagement. And I think that what we are hearing today is a really big step in that right direction. I also, would say as we get started and as we are talking about this, we're probably closer to the beta of this than the completion of where we want to go. And so as we, lean in, as we engage, as we educate the public about where we are, I do think it is important for all of us to acknowledge that some of the answers are not going to be here because we are creating this as we go. That being said, my dad used to say, like, son, I'm being tough on you because I love you. Tough questions about this program, especially in its inception point and where we are in its history, are important because I love this program and what it can be for our community and how it can keep our community safe. And so, going forward, like, so one of the questions I have, I know we talked and Director Dan G, you talked about the funding and in previous conversations, you know that I've been hitting on this, understanding what the real cost of this is, and I appreciated Chair Remy's question there. And the reason that we asked this question about what are the real cost of this program is because as an oversight body, if we like it or we don't, we still need to know what our impact is on making it better or sustaining it even. And so I appreciate today that we heard that Director Giagardella, would you please, I got it right. Did you hear that, everybody? That was, yeah. Director, you said that so currently, and I'm okay with roundabouts on this because to the listening audience, one of the difficulties in trying to figure out this budget is because it does come from several different parts of the budget, and you heard we have different funding sources, grants and such. So we're trying to figure out specifically, but $4.5 million currently is a program that we think is operating with the current staffing that's going on. And then pertinent to the question is, you know, what are the new costs that the mayor is putting forward in the budget that has presented to council? And I heard $2.4 million for that expansion. Is that correct in my understanding? Just regurgitating what you said to us earlier, Director.
Yep. Yes, President Harden. Yeah, the current model looks to be, like I said, just shy of about $4.7 million. And then the mayor has provided expansions in the citywide account funds for about $2.4 million. In addition to that, we have 5 additional dispatchers in support services. I think the total for that is around $500,000. And then 5 additional paramedic firefighters as well. I think the total cost is around $680,000 for them as well. So that is in addition to what is in the citywide account available.
Thank you. And this, I think that a few folks hit on this, and it might have come from the first question from Chair Remy around expansion costs. So the $2.4 million gets us the expanded, for the Spark team, gets us an expansion of another unit, which is a fire department paramedic, a licensed social worker. For the React team, it gets us another fire department lieutenant, a paramedic, and a CPD, CIT officer. And then for the MCR, it gets us another CPD, CIT, and a CPH. As we move forward with this program, even throughout this continued beta year, how do we assess how we add to the program, specifically around timed offerings? And I forget who was speaking to this. How do we go, because I know part of the plan is to expand from 4 hours to 8 hours offering per day. How do we quantify, how do we look at where we go from here in terms of the budget, in terms of expanding when these programs, be it Spark, React, MCR, are available to the public? How do we as council, how should the public think about this in terms of where we continue to go as we continue to expand and grow this program?
President Remy, President Harden, Safety Chair Remy, I'm going to let Anita and Ken address the expansion of hours because I'll probably say the wrong one. I know that we're looking to go 8 hours, but I don't recall if it's the noon to 8 or if we're looking in the morning hours first. But that's obviously something that we're working with Health on to see where where are the best hours to use for this program? So I'll let them address what we've talked about going to the 8-hour program.
Ken, I'll go ahead with some of the discussion about the hours for the RRU. Our goal really is to place clinicians in from 8 o'clock until 4. And we're hoping that we can do that fairly soon this year, like January, February, and then start building out those hours into the evenings. But they, again, and I'll probably, Ken, I'll need your help to, to get a little bit more detail on the dispatchers. We've been really trying to work with the dispatchers on how many clinicians can work with the dispatcher, hoping to be able to have a dispatcher take, have a couple clinicians they work with at a given time. And then we'll continue to hire as we have the right amount of dispatchers with us too. And then we also need to think of spacing. We have to have a place to put everybody. And again, I know we keep saying that pandemic's really thrown us for a loop on some things. Spacing is a problem to make sure that they are separated and have social distancing too. So Ken, do you have anything else you want to add with that in regards to hours?
No, I think you're right on point. We do have some constraints or barriers. That's obviously for us in the communication side is personnel. So as Director G had mentioned earlier, we are attempting to expand. We're putting forward some of the largest call-taking classes that we've seen in many, many years in the communication center, just trying to meet our day-to-day functions, let alone the expansion of the RRU. Although we are extremely excited by this RRU program. We are doing everything we can do to support it and grow it as well. Part of that is trying to find using technology. Of course, support services has a large technology support, and so we're using technology combined with policy to try to address the lack of dispatchers that are available to go into the RRU so that we can continue to grow. So that is our challenge here in the communications center, but we are meeting that. Unfortunately, that's not a very quick response. It takes several weeks to at least 10 weeks for a call taker to go through training, and then another 3 months of actual hands-on coaching training in the communications itself before they're available to be cut loose on their own. So again, we're using technology to our benefit to try to work with Columbus Public Health so that when we can't provide a dispatcher in that room, we can still expand our hours by the use of the technology.
Thank you, Director. And I'll leave it here, and then we'll come back so other council members can ask questions. But do we ever envision? Because I think about knowing what a little bit that I know about safety and how we engage. Chain of command is very important. We have a amazing 3 or 4 different programs, 3 or 4 different offerings that really is bringing together several different departments. But it's kind of hard to do the command chain of who is in charge. Do we envision having a chief or a leader of this effort in the future? Do we envision having a director of, a chief of, some type of command chain that would be easily digestible or understandable for the public and truthfully for council?
President Harden, Chair Rimini, members of council, I think as this grows, I think there will need to be more of a point focus, for lack of a better way to describe that, as to where this program will reside. Having said all that, this is so far it's been a very good collaborative effort between Columbus Health and us, and I think at some juncture, yes, I think us policymakers, we're going to have to make some recommendations as to what the command structure, if you will look like for this group going forward. But I don't think we're there quite yet.
Got it. I'm going to turn it back over to the chair.
Thank you very much, Council President. Councilmember Barossa de Padilla.
Hi, good evening. First, I want to start off, like many of us before we were council members, we were citizens, so I just want to thank you for all of the work that you do all of the time. I grew up right down the street from a firehouse, and I feel like very, very often coming from a house with some chronic illnesses, this was our first call, so I appreciate deeply the work that this department does. I wanted to ask a couple questions. First is, and you addressed this a little bit with the 911 call takers, but I want to talk a little bit about the actual folks from the fire department who are staffing these particular teams. And can you talk to us a little bit about the staffing for those folks, the training, and then where do we recruit them from? And how long does that process usually take? Because I'm just thinking as we think about the beta year and as we think about adding to these teams, who are we recruiting? What kind of training lag time is there in getting these folks out into the field?
Heather Parrish, you might want to address that one, sir.
Yeah, and I appreciate the question. It is a challenge, and it goes to kind of the core of this conversation of we're blending three different agencies together that have different work schedules, different labor contracts, different training and onboarding schedules. With it being a fire-based program, all of our individuals are firefighters first, and for these pilots or the programs with React and Spark, we have hand-selected a very diverse, experienced group of paramedics who most of them have some form of lived experience or personal connection with this work and are very dedicated to it. We do provide them additional training. All of our members go through the CIT crisis intervention training. We go through other trainings with our clinicians, and vice versa. We have our clinicians that work on our team go through some public safety training, because when you're working together, you need everybody speaking the same language on the same page with the same objectives. There is a disadvantage or a longer time to hire a firefighter for one of these roles. But I think that's where the collaboration really pays off downstream, because when these teams aren't available and our regular EMS crews are responding, they have a lot of this training or they're exposed to it or along those lines. And then again, a lot of those specialty units or specialty skill sets, that's where we've really leaned on our partners. Lieutenant Tolliver talked about the 6 different agencies that make up the React and Spark programs. And now we've added Columbus Public Health to the alternative response. So we brought in another agency with another skill set. So it's really about providing those resources and having access to all of those resources in real time. And that has been one of our challenges from public safety. I've been doing this for 30 years, and there's times where I've been on calls and go, you really don't need to go to the hospital. You need this, but I don't have that resource available to me at 2:00 in the morning as a paramedic on the scene. And my only default is to take that individual to the hospital and hope the hospital connects them with the next step. Well, now we've got follow-up teams that can come out and assist and connect that individual with that resource. So I wish there was a off-the-shelf product that we could say, this is the one that's going to fit and work, but it just doesn't exist right now.
No, I appreciate that answer, and thank you for, I'm sorry if I'm interrupting, if there's Lieutenant Tolliver, if you wanted to add on to that, but I appreciate that answer. I was thinking about, you said it's your firefighters first, so obviously there's a process to becoming a firefighter first, and then if we're pulling those folks off, what additional training might they need so that we can build that bench so that they can be part of these specialized teams, so I appreciate that answer. I'll stop. Lieutenant Tolliver, did you want to add something? Okay. I'll keep going. I also wanted to ask 2 more questions. Another question just around, and I know that this is something that we're working on as we think about the diversity of all of our departments, but have you had any, experienced any, or are you addressing any language access issues that you might come across when you're coming onto these calls? Because I'm thinking, I know that this is a challenge for us overall, but as I think about these like specialized teams, are we running into any challenges with these teams as they go out to calls and having language access issues, and then how are we addressing that?
Lieutenant Oliver, you want to answer that one?
We do have people that we reach out to when we do come across somebody with that we have a language barrier with. We did have a cadet that could speak Nepalese, so we were able to utilize him over the summer. We also have a gentleman that works here in fire prevention that speaks Spanish, so we use him a lot as well for targeted outreach.
Great. And then obviously, I know that this is a longer issue for us to continue to work on. Also thinking about other, hearing impaired folks or other things that and I think, we've probably had a longer runway and some more experiences in that area. But as our community continues to become more and more diverse, just continuing to work on these issues and access. And then my last question is just around this list of items to be addressed. I'm thinking I might have a hint at what the answer to this question might be. But as we're thinking about prioritizing the things that we need to move this to the next phase, if you looked at this list of the items to be addressed, what would be, in your ideal world, what is the number one priority of how to move us forward into the next phase? If you thinking about resources, thinking about if this was the thing that we could move forward, what is the number one priority?
Well, I guess Councilmember President Harden, Chair Remy, I guess I'll address that. Some of my colleagues might have some different priorities on there, but obviously people. We can't make this run without having personnel, and whether that's, as Administrator Coots talked about, the call center, whether that's a call taker, dispatcher, or the social worker, the clinician, we need them. And additionally, you need our response teams. We need police officers and firefighters. So I think, candidly, I think as simple as that is, I think that's the real challenge for us right now, probably more than anything. I'll let my colleagues, if they want to chime in on any of that, or they vehemently disagree, go ahead.
Now, can I go ahead and say a little bit more about that? I know, council member, my biggest concern is staffing, and we all have that concern. And I had shared just recently, if you drive down High Street, Broad Street, anywhere, and you look at restaurants, they're paying us, staff are trying to recruit $1,000, $2,000 sign-on bonuses. Private sector is offering to pay off student loans. How are we competing with the city? So it's just not about Columbus Public Health. It's about all our city programming, how we can be innovative in bringing in the most diverse, most talented, qualified individuals. We just, we've been posting for the NCR positions. Typically we get 20 applicants. We're getting about 5 now. And out of the 5, you get a couple that are qualified. So, I don't have a dollar amount to give everybody, but it's just an issue, a large issue at hand with the city that we need to address. So thank you.
And I appreciate you elevating that. Like I was saying, I could have guessed based on this conversation that was going to be your answer, but I think it's worth saying out loud and elevating as an issue, and also for the folks hearing that, well, we need you, and this is a good place to come and work, and you can literally change lives. So thank you for elevating that, and it gives us good food for thought as well in terms of thinking about how do we resource this program, because I think as we look at the budget, and we're talking about budget numbers, unless we have the people to fill those positions, again, this is not just an issue that we can budget for. This is a problem that we're all facing. And so how do we start to get really creative and work together to ensure that we have the people to really address the issues that we're talking about? So thank you. Thank you, Chairman.
Thank you, Councilwoman Member Barosa Padilla. As chair of the Administration Committee and Civil Service, this council's keenly aware of the challenges that we are going to be facing. We are facing right now in a post-pandemic world. We're not even post-pandemic yet, but we know that we have some significant work that we need to do in 2022 in order to be competitive, and that includes straight to your employment concerns that you just mentioned. So I appreciate you highlighting that, because that's top of mind for many of us on the dais. I am going to turn it over to Councilmember Faber if she has any comments or questions.
Thank you so much, Councilmember Remy, and good evening, everyone. I too want to thank everyone for their call, for the presentation this evening. After the unfortunate death of Ma'Khia Bryant, myself, along with Councilmember Harden, or President Harden, were very outspoken about the need to really bolster our alternative crisis response in Columbus. And that was not a very well-received position at the time, despite the fact that we had part of this unit up and running already. And to see the progress that has been made in a little over just shy of a year is really encouraging for residents. And with that being said, I'm just wondering what the engagement and outreach looks like moving forward, because there are a lot of residents who were definitely interested in this conversation, definitely in support of alternative responses to crisis issues, and may be unaware of what the city was doing prior to the incident, but definitely all of the additional programming that has been created since then. And so that would be my question. I'm not sure who could, if that's Dan G, who could answer that question.
Councilmember Faber, members of council, thank you. I think you bring up something very important, and that is how we communicate what we're doing, some of the success we're having and going forward. As you know, the mayor's done a couple of press conferences on this. I think there has been some media interest. There has been a few things out there. Don't recall which media. Some of it was television. But I do think as we grow this program, I think it will be important for us to engage our information officers and begin to craft, put some information out there. Here's what's available to you. Here's what we can do. Myself, I don't, I'm a personal believer. I don't want to oversell something, but at the same time, I do think it's important that we have a communication strategy, and that's certainly something that I think we'll take from this meeting and see what we can do going forward. Thank you.
That's good to hear. It's good for all parties involved. I'm thinking I've been engaged in a lot of conversations with businesses, business owners, and folks who are really concerned about having another option if they find themselves or a patron of their business in a moment of crisis, or a family member in a moment of crisis, and may have pause about dialing 911 immediately. So that constant communication and engagement is key, I believe, to the success of the program and continuing to build support. So wonderful job, and looking forward to continue to engage. My next question is just around what case management looks like. Is there an opportunity for additional engagement after we have worked with an individual or referred them, or do we leave that to the respective professionals?
Councilmember Faber, I'll let I think between Commander Jeffrey or Captain Parrish or Lieutenant Tolliver, or maybe even Anita Clark might be able to position address what. So whoever, I know that we do have somewhat handoffs out there. So Fire, if you guys want to start first, and then we could take it from there. Thank you.
Yep. Thank you, Director and council members. I think, Commander spoke about it earlier, that a large majority of the individuals that we respond to are already linked with case management, right? So as public safety responders, we show up in the moment of crisis, and our main job is to stabilize that situation, make sure they're linked with the next step, and then make sure they follow through or get connected back to their service provider, or if they're not already linked, get them connected with the right service provider for their needs. So that is one of the as a public safety provider, that's one of the things we've never seen downstream. We drop you off at the hospital ER and we hand you off to the hospital, and we just think they're taking care of everything from there, but we found that we see you again, or in a different situation. So I think it's going to be a difficult, or not difficult, but challenging, because again, we want people to have choice in what their next step is. We want them to have say of where we're directing them, and make sure we're linking them with that right resource. And again, we've got a lot of agencies out there that want to be involved in this, and we can't just steer them all to one, or we're going to overwhelm them. We need to make sure we're doing it equitable. We're make sure we're getting folks to the right resource for their needs. We have great collaboration with Adam H and their network providers. I think 988 is going to be a game changer. You talked about having a choice to call someone different. I think all too often, folks tried to call someone different, and it was after hours, and then they defaulted to 911, and that's where this revolving cycle of 911 becoming the catch-all provider for everything, why we've ended up where we're at now. So we've considered, that's a lot of those conversations we have with the other communities across the country that are doing this, is tell us how you guys do it, so we can learn from you and what challenges you faced already, so we don't have to start at ground zero. And again, we've done that with React and Spark. That's really what they do, is shepherd somebody through that process until we know it's stable, they're linked, and then we can hand it off and do that warm handoff and let them take it from there and save us for the next crisis. Because those follow-up work take a lot of time. Like, that's just a lot of navigation. And the crisis stabilization can be managed in a shorter time. And that's really where we feel public safety fits in best.
Well, and I appreciate that response. And it's the recognition that, we can't do everything. We can't solve all the problems, and we're not the professionals of everything. And so relying on those after we have made a good referral, I believe I'm messing up the phrase that you all used earlier, warm referral or warm handoff, I think it was. Once that has been established, we should be able to rest in good comfort that that person is in the right hands, and hopefully we won't have to engage with them again. Once again, thank you all for the work that you've done thus far, and looking forward to continuing to work alongside you as we really ramp up the alternative crisis response unit overall. Thank you. Thanks, Councilmember.
Thank you very much, Councilmember Favor. I'll next turn over to Councilmember Dorrance.
Well, thanks again to everyone here tonight. I think the theme that I've heard here this evening is the goal to have, the building blocks in place and to continue to build upon those that are already here. Just to appreciate the opportunity for us as a city to confront this issue from a public safety standpoint, a little bit of a different way that tries to meet folks with the appropriate response. And Chair Remy, I appreciate you and Council President Hardin for leading the effort to look at ways that we can continue to invest in this in the future, and look forward to us understanding more about the success of what's already been deployed and what's going to be deployed. And I think Dr. Roberts mentioned it quite well, and other folks have as well. The challenges we have in recruiting folks in this area to be the best and the brightest to meet these challenges. And I think that's going to be a big task in front of us to make sure that we've got the ability to do so. So thank you for the time this evening.
Thank you very much, Councilmember Dorrance. I know Council President Hardin has a couple of follow-up questions. Sir, the floor is yours.
Thank you, Chair, and thank you to my colleagues. All the questions are, again, hopefully showing this council's interest in supporting, but also moving and making this thing better and more effective for our residents as we move forward. One final question and a final comment. We talk a lot about staffing, and one of the things that we know to be true this year is that folks are asking for more police officers in this budget. The mayor proposed an additional police class, which I personally support, knowing that we are down now police officers. But the question is not just about having more police officers, it's about how we use the officers that we currently have. And as we look around the country at folks who are doing right response, there are other models yet that we have not baited that are completely, for instance, making sure that we are just sending out non-police officers to instances of like homelessness or parking tickets or youth related. I know that again we're in the beta of this, but as we think about the where we want to go and what is within the realm of possibilities, do we ever see baiting out or piloting out a specific non-police response, especially as we are trying to make sure that with the limited police that we do have, that we're using them most effectively?
President Harden, I'll take a stab at trying to address that head on a little bit. So as you know, the RRU is pretty much, the intent there is to get a non-police response. That's, of course, the purpose of the social worker in that room. And then to also partner, hopefully, if they're able to resolve that issue, we can get them with a social services agency. So obviously, I think Administrator Coons had mentioned a little over a third of responses required no police response whatsoever. And I think also of the probably 500 calls now that we have handled, I think we're still in that area where we've not had a use of force or a negative outcome. I think Commander Jeffrey could either confirm that for me. I know for those first 450, we did not have any issues with that. So yes, I think that's certainly something we're looking at. I think also to keep in mind, we're not quite sure how 988 is going to work yet. I think those are things that we're looking at. Is there a collaborative agency out there? Adam H, for instance, as they come online with their facility, are there more opportunities there as well to not have any kind of city response? And again, we have a significant number of response from our Spark and React teams. Some of those which do not have a uniform officer involved in those. So there is, and you're absolutely right, there are other models out there. We're certainly open to looking and listening to whatever is successfully done in other cities. I think Captain Parrish, I know, has a real ear for that he's been looking at what other cities are doing as well. So again, I appreciate the question. It's certainly an appropriate one to ask, and those are the things we're looking at. We'd rather not send our police officers as well. I think we'd rather use them for other things if we could. So thank you. I don't know if anyone else has a chime in on.
Director, I'd like to add to that and expand upon the council president's question there. Since I've been on the department almost 30 years, we've had a non-uniform civilian response for inebriated individuals that are homeless, where we refer calls to row 1 in the net care van, which is totally non-public safety, but we dispatch them through the fire unit. So that's been going on locally here for 30 years. Again, to Councilmember Favor's point, we don't communicate well or brand that well because it's not our agency. We're not the agency, and we're not promoting that or making sure folks know that individual or that resource is available. And that's available through NetCare's line or through 911. To your point about staffing, yes, we all need staffing. How do we do it more effectively in a better way? I think a lot of the programs we're working on here in the response units, that you're going to see a return on the investment of those teams in call reduction. Again, to Councilmember Favor's point, that follow-up piece, so getting engaged early, getting them linked early, getting them connected early instead of having 15, 20 EMS and police calls on that individual, we may reduce that down to 2. And then that frees up the traditional response for more traditional police work or more traditional fire and EMS work. So it's all connected, and we're considering all those things and where that best fit is. But ultimately, it's really about creating a system of care that starts with the lowest, least invasive, intrusive response that meets that individual's needs. And then if it comes to the point where public safety and law enforcement or fire need to be involved, we're here as the ultimate safety net. The community providers, those other response teams, if they resolve it, that's the outcome we want to see. But at the end of the day, there's only one agency in the city that's always going to answer the phone and always going to respond, and that's public safety. So to our third aim in our project is, when that happens, how do we make sure we're doing the best we can do? And it just all goes hand in hand. But very insightful questions. I really appreciate that thoughtfulness. So at least it gives me and I'm sure our group a good feeling that we're heading in the right direction with our project, because we have considered those questions that you're bringing forward. So again, thank you.
Director.
President Harden, also, if I may, I have another appointment at 6, and I apologize. I'm going to have to leave the meeting. But Grant Ames, who I know you're familiar with, and has helped coordinate this meeting, can be a little bit of the MC if he needs to. So I apologize for having
I'm about to hit Grant Ames with the toughest of questions, so it's a perfect time to sign off, Director. No, thank you so much to everybody. I mean, and I'm not wrapping up yet. I'm gonna turn it back over to the director, but I did want to go back to Councilmember Favor's point around communication. I think it's important, and I think that either the way we framed the question or the response, it was seeming like the importance of communication was to just inform the public on what we have done. And that is certainly important. Folks don't know the good work that you guys are doing. They just do not know. They do not know that you are speaking this way. They do not know that we as a city are thinking about public safety this way. They do not know, and I know that to be the case. But that's only half of the issue. The other part is, this is a community-based response. This is another response that is encouraging us to go outside of our traditional forms of safety. So that means this is a huge opportunity for us to hear from the public about how we can make this better and how they also want to be engaged. And so I think, one of the roles that I would like council to play in the next months going forward is, how do we pull together a group of representatives from the community so that we can have an ongoing two-way communication about this, so that they can become both provocateurs to make sure that we are pushing this as far as it can go and reaching and creating something that is good and sustainable, but also that we are establishing non-elected official, non-city paid ambassadors to go out to different constituency groups and sing the story about what this is doing, because we believe that this saves lives. And so that was my question and my point. I'll turn it back over to the chair.
Thank you very much, Council President Harden. When we were being briefed on this, we ultimately knew that this had to get out to the public, because the great work that they've been doing has been significant in a short period of time. We know that there's work to be done to make this more, to expand the services, to make it work for the community. But to the Council President's point, we encourage people to reach out to my office to make sure that we are hearing from you. We want to understand the ways that you can contribute to how this is shaped and formed as we move forward. And so we'll also convene many opportunities for people to engage and provide further testimony other than just for the night. We did receive a question online that I want to ask, and it was this. It says, if the peak hours are 11 to midnight, What about running 1 to 8 or a traditional second shift as it relates to the right response unit? Valid point. So I'll let whoever wants to take that question, maybe Ms. Clark or.
Yes, I can go ahead and take that. Our goal is to look at second shift, and that's what we're aiming to do. We have hired another supervisor for the RRU, and they will be trained up to do a second shift. But again, we have to work really closely with the dispatch center to ensure that they have dispatchers to take those calls at that time too. But that's our next goal. And Ken, do you want to add any more to that?
You're absolutely right, Anita. That is our goal. We're very aware of what the peak hours are, and we very much want to mirror those hours with our services. Right now, we do have a crisis in personnel for the communication center that we're working through. And unfortunately, that is also afternoon shift is also the peak hours where we begin in the communication center for those, we received 700,000 911 calls and another 900,000 non-emergency phone calls. So as you can imagine, the volume of calls and the work that our folks are doing in the communication center, it actually amazes me every day. But I can tell you, along with Director Clark and Director G, we've worked out a very comprehensive hiring and training program. It's very, very aggressive, and we believe we'll have a solution, hopefully in the near future. But like I said, 10 weeks for a call taker on top of 3 months of training. But we are definitely headed in the right direction, and we certainly the intent is to mirror that community need 100%.
Thank you very much. I know it's somewhat of a challenge out there at the call center. We toured it. My team toured it in December, but I feel like we're in the right hands and the right direction moving forward. But again, we'll put that call out there for people to apply. We need good bodies and people to work for the city, and we're going to make sure that people are appreciative of working for the city as we move forward. Are there any other questions or comments from my colleagues before I move into the public speaking portion? Okay, then we have 4 speakers this evening. I want to start with the first one is via, I believe, WebEx. Heidi Hughes, if you could state your name, your address, and any organization you may represent. You have 3 minutes, and the floor is yours. That was easy enough. Just make note of the record that Ms. Hughes is not available. Our next speaker is Chana Wiley, and she is in person. If you'd come to the podium, Ms. Wiley, and state your name. Any organization you may represent, and you do have 3 minutes to speak.
Hi, I'm Chana Wiley. I'm a resident of Columbus, and I'm with Ohio Families Unite Against Police Brutality, also Ohio Families Unite for Political Action and Change, and the Columbus Safety Collective. President Hardin and Chairman Remy, I look forward to the 988 program. It sounds really exciting. And I'd like to say that I appreciate the creation of the pilot program, as it is a good start. But calls coming through the triage pod should not be responded to by law enforcement. Instead, these calls should be routed directly to non-police crisis response systems that consist of medics, trained clinicians, social workers, and peer support specialists. The goal of the dispatch system should be to appropriately address the health needs of the community and reduce police interactions as much as possible. In order to meet that goal, we need to establish a robust non-police alternative response system. It is not enough that law enforcement still responds to calls of mental health crisis while looking to the pod for de-escalation information. Police are not trained to respond to mental health calls and are often uncomfortable in doing so. It is also difficult for the community to trust the police to respond appropriately in these crisis situations, which is why many Columbus residents are already unwilling to call 911 for help when in the midst of a crisis. Even with a co-responder model and a clinician by their side, the simple presence of a police officer can escalate matters for people who are experiencing a crisis. In an MCR model, police are still the decision maker in those moments of crisis, and they often turn to forced treatment such as arrest, incarceration, and involuntary hospitalizations. In my brother Jerron Thomas' situation, such decisions unfortunately led to his passing. It is important to remember that a crisis involving mental and/or behavioral health does not equate to danger, and when the police show up to respond to these situations, it reduces the chance of people getting the help they truly need. There are many alternative response programs across the country, such as the CAHOOTS program or peer support models, that immediately show up with crisis intervention specialists who have proven to be quite successful by using unharmed de-escalation techniques. These are often individuals who have direct work-life experience with mental health crisis and who represent the most impacted communities. They have been able to avoid excessive pink slipping, arrest, and incarceration. These types of models also save money and resources. Data shows these programs work and they are effective in connecting people with the appropriate services, support that they need in their time of crisis. A trauma-informed, peer-led, and community-based response system will build trust so people feel they will get the help they appropriately need when they call. This is why Columbus needs a diversion of the point of 911 dispatch to a non-police response system. We want the best outcomes for our Columbus residents, so I encourage you to consider the input of our community members and their needs. What's best suited and will be most effective for our Columbus community is a dispatch system that will divert mental and behavioral health crisis calls to a non-police alternative response system. Thank you.
Thank you very much, Ms. Wiley. Our next speaker is Steve David.
I'll respond if you don't mind.
Sorry, Council President Harden.
Ms. Shine, I just wanted to one say thank you for coming down. I thought, obviously that was the point I was getting to with the question. My final question was just to make sure that we are exploring all the options. And what I heard from the team was a willingness to explore. This is not an anti-police conversation. It's about how do we get the right response to the right folks. And I think that a lot of us are under the belief, and if we look around the country, there are different programs that send different folks out. And so, again, we need that type of feedback, and we need that to be a part of, we need to hear that as we build this program out. But to everybody that's listening, to all of our folks who want us to be better, and we need to be better, I would just give them a little bit of space that this is the beginning, not the end. So I would welcome your engagement as we move forward, and we want to set up some type of a formal process so we can have back and forth conversations like this more often. Thank you, ma'am.
Thank you.
Yes, thank you very much. Our next speaker is Steve David. Mr. David, you have 3 minutes, and state your name and the organization that you represent. The floor is yours.
Yeah, Chairman Remy, President Harden, my name is Steve David. I live in Marion Village here in Columbus, Ohio, and I'm here representing the Columbus Safety Collective. I want to thank Ms. Wiley for her testimony before me, and I'm going to, my written testimony was sent into your offices, so I do want to take a bit of Council President Harden's question about the non-police emergency response component of this and really continue to put a pin in that, as I think it is a really critical piece of what the residents of this city are asking for at this moment. So, during the Reimagining Public Safety process last year, y'all collected nearly 4,000 survey responses from residents of this city and asking them their opinions about public safety. And 90% of those people said that they were comfortable or very comfortable with a trained crisis team responding to homelessness issues without police. 84% of people wanted, this kind of team responding to mental health issues, and 82% saying they wanted for general behavior issues. So of all the issues that come before council, I feel that this notion of a non-police crisis response team is probably the most unequivocally agreed upon of things that y'all are talking about right now. And I'd really like to see us continue to move in that direction. To take up a couple of the other pieces that I think are intersecting here is and and apologies if y'all hear some crying in the background. Of COVID has been tough on our household this week, thus me being on WebEx. So the other piece that I think is really important here is this notion of how the community is involved, and having robust, transparent community oversight involvement in how this program is built, and how people are, and how it continues to grow and respond to our resident needs. So to me, this really looks like having an advisory board of directly impacted people, people with lived experience, who get to be the ones to see how a non-police crisis response program would be administered, would be run, and make sure that they're using the best and most current evidence-based practices. And then finally, to address this piece about staffing, one thing that I think the real opportunity holds for a non-police peer-led model is that we can open this up to folks from our communities who have the most cultural knowledge already, to get them into these kind of positions. And so, we would really love to see something that is akin to how police and fire have robust training procedures to bring people in, but have that other bucket that people can go to, where folks who want to serve their communities and have the cultural cachet to do so are able to get in that pipeline into leadership and to serve their folks. So grateful for this conversation that y'all had today, and myself and the other members of the Safety Collective are looking forward to continuing to be engaged in the process. Thank you.
Thank you, Mr. David. Appreciate you sending your testimony yesterday evening that we forwarded on to both myself and Council President Hardin. So please stay engaged. Appreciate your input. Council President Hardin.
Thank you, Chair. I would just, I don't want to highlight too much and blow up his spot, but Mr. David is one of the most well-versed persons in right response out in the community that I know. And I think that a lot of the things that he just hit on are things that this council would be well advised to explore. And I think the proximity, closing the proximity between a person like Mr. David and some of the amazing folks like Mr. Parrish and folks who are developing this program only can make it better. And so I just want to thank the advocacy. And I just want to be clear. As we talk about right response and we talk about non-police options, it is not an anti-police. It's about sending the right person, the right issue. And there are times that we just because I don't want folks to read this wrong, where a police officer will need to be. There are many times specifically where a police officer will need to be either brought in or because of the call and the nature of the call, and people who are more well versed in this space than a lot of us will know that there needs to be a police response. But I think that what we're hearing from some of our residents, and certainly what we heard last year, was there are also times that we believe that that might not be the necessity. And I would just again tie it back to the current police shortage that we have, which I acknowledge that we do have, and making sure that we are best utilizing. And again, I heard time and time again this evening, I've heard from the administration, I've heard from our folks in safety, a real willingness to have this this conversation and be innovative. So I just want to, I guess I'm giving my final comment. So this is the last time you hear from me. But I do want to applaud the innovative thinking. We are, to the public, we are not there yet. I think that Parrish and Director Dan G and everybody, Ms. Clark at Safety, we would all acknowledge we're not where we're going to end up. But we are a lot farther than we were 2 years ago, a year ago. And that gives me a lot of encouragement. And so I look forward to some of the next steps, working with the chair and working with the administration about how we can bring in the community input going forward.
Thank you very much, Council President Hardin. Our final speaker this evening is, and certainly not least, Claire Decker. If you would state your name, any organization that you represent, and you have 3 minutes. The floor is yours.
Thank you, Chairman Ramey, President Hardin, members of council, for the time to speak today. My name is Claire Decker, and I'm also a member of the Columbus Safety Collective. So I'd like to say thanks so much to the other speakers from CSC for your testimony. I wanted to start, which I had to edit my remarks before speaking because of how well this meeting went. So I'd just like to start by saying this is the most exciting hearing that I've ever attended about the alternative crisis response topic, and it certainly isn't my first. The language, questions, and ideas being shared give me hope that we're headed in the right direction, and I can just take this moment to appreciate that we're not done but I still think that the importance of the CSC showing up and saying what we believe based on the research that we've done is important. So that all being said, the Right Response Pilot is just the beginning of our work to reimagine public safety. Working to divert mental health and other nonviolent crisis calls from law enforcement is a great start, but having those appropriate alternative response teams to close the loop is equally as important. We need to put funding behind a robust, in-person, non-police crisis response option for our residents in a variety of crisis situations. We believe in non-police crisis response as an important tool for this Swiss Army knife, as it were, to include. An article published in August of last year stated that the data from the pilot showed that more than 60% of calls didn't require an immediate police or fire response, and then almost half were resolved without any police or fire response at all. Earlier in this call, we heard that drop down to like 1/3, so I'm assuming that's just from the rest of the data that wasn't available in August of last year. But we know that there's a large chunk of these calls that don't require police intervention, so that shows us that we have a need for a crisis response made up of other types of responders, including those who specialize in mental health and connection to resources. In 2020, Columbus Dispatch took, as we heard earlier, over 22,000 calls that involved a mental health concern, and our current MCRUs were able to respond to somewhere around 20% of those per my research, and that's about 1 in 5 callers getting the response that they deserve from a professional. The documented relationship between mental health and police violence reflects an incongruity between a police officer training, even those with CIT, and the community need. Across the country, police officers report feeling inadequately trained to assess and address mental health problems. And we've seen police response to community needs related to mental health or substance abuse referred to as non-traditional policing. We believe that this term indicates that police do not receive proper training to manage these situations, and right now 4 in 5 of these calls are still being responded to by police here in Columbus. Existing programs show that health workers and other community members can effectively promote public safety here in our own city. We heard about REACT and Spark, demonstrating that health-centered response does work. So we have proof of concept, and we need to expand access to these types of programs in our city, especially with the potential expansion of this care traffic control, this 988 number. A non-police crisis program like the one we're calling for in Columbus, as we have heard tonight, exists across the United States in places like Eugene, Denver, Austin, San Francisco, New York, and LA, Albuquerque. In the last year have all started or continued such solutions. The programs consist of paramedics, nurses, behavioral health specialists, peer responders, and are accompanied by a community health worker. Police are called for backup as needed, but our existing programs show that it's only necessary in less than 1 in 10 calls. So I'm just going to end by saying the fact is that we really need to keep beefing this up, keep having these conversations. We envision a Columbus where every person calling 911 or in the future 988 in a moment of crisis are met by a professional team who can not only safely respond to the situation in real time, but also connect that person with treatment and resources in the future. Thanks so much for the time.
Thank you so much for the testimony and truly partnering with us with your bringing your expertise into the discussion. We know that we have got a great team working on this, and as Council President said and others, this is only the beginning, certainly not near the end, but we know that they're taking best practices from around the country to really build hopefully one of the best programs in the United States. And I really have the full confidence of this team to do the right thing and continue to push to make sure that we are getting a right response for every call that comes through our emergency services. And so I want to thank everybody this evening that participated, everybody in the Department of Public Safety and Columbus Public Health, Dan G., Director Dan Giangardella, Ken Kuntz, Anita Clark, Commander Jeffrey, Lieutenant Tolliver, Captain Parrish, and a late arrival, Grant Ames, very familiar with us here on council. Good to see your face pop up. And thank you for all the work in preparing this hearing and for your contributions in ensuring that these services are successful. I want to thank my team, Jeffrey Carter and Lucy Frank, our Legislative Research Office team, people such as John Oswald, Matt Erickson, and then James Lewis, Mark Carter, and the CTV team for their assistance in making sure this committee hearing took place today. Stay safe, everyone, and have a great evening. Thank you.